In the last section, we discussed Medicare and its related coverages. As you recall, Medicare was created in 1965 as a federal health care program under Title 18 of the Social Security Act. Its purpose is to provide health insurance to people 65 and older, regardless of income or medical history, and certain individuals under age 65 with qualifying disabilities. This is known as Medicare Parts A and B, or traditional Medicare. Part A, the hospital portion of Medicare, takes care of facilities. The vast majority of individuals get Part A at no premium, as it was paid for during their working years through FICA payroll contributions. Under this part of Medicare, coverage is provided for beneficiaries for hospitals, skilled nursing facilities, hospice care, and more. Part A has a per-occurrence deductible and different cost-sharing requirements based on the length of the hospital stay. Remember, a beneficiary must be out of the hospital 60 days to enter a new benefit period, which would then require that a new deductible be paid. Part B of traditional Medicare is the medical portion and is voluntary coverage. All beneficiaries enrolled in Part B must pay a monthly premium. For Part B, think people, as it covers doctors, surgeons, therapists, and other individuals that treat beneficiaries. We then had a discussion on Medicare Part D, the prescription drug plan. While not part of traditional Medicare, the prescription plan was added in 2006. Since its inception, many changes have been made to Part D plans, including the troublesome donut hole gap in coverage. Our next section explores policies that work in concert with Medicare. These are Medicare Supplement or Medigap policies, as well as newer options for beneficiaries, the Medicare Advantage Plan or Part C plans. Both Medigap and Medicare Advantage plans are issued by private insurers under contract with the Centers for Medicare and Medicaid Services, known as CMS. Both of these plans add significant coverage to Medicare's offerings and are extremely popular. Like all insurance plans, these are subject to both federal and state rules regarding concerns such as advertising, truthfulness in marketing and sales, disclosure notices, and more protections for purchasers. While both of these policies are intended to add to Medicare's offering, they are substantially different in nature and scope. As such, make sure to study this information carefully. We'll also provide you a small refresher when you get to Florida-specific laws and rules later in your course. Medicare supplements are heavily regulated by CMS and state insurance divisions and have been formulated by the NAIC's Model Act. They've been standardized, and the plans are differentiated by the use of the letters A through N. Plan A, the core plan, contains what are called the core benefits, and each of the plans must include these core benefits. Medicare Advantage plans typically provide coverage well beyond what Medicare offers, but are not offered throughout the country. Even though these plans have been designated Part C plans, they're not part of traditional Medicare. Once again, they're plans sold by private insurers working with Medicare and CMS. We'll also discuss Medicare Select policies. These are Medicare supplement policies that require network provider use. This is different from Medicare supplement policies, which are any provider policies. We'll discuss legal requirements surrounding issues like pre-existing conditions and how these policies may treat exclusions. The senior demographic is heavily protected through laws and rules, and as you progress through the material, you'll see what we're referring to. We'll close this section with the Mother Test. The Mother Test is a simple method that can help you determine whether a sale is appropriate to a consumer. Yes, there are many laws and rules that govern insurance policies, but is what you're offering to a prospective insured something that will pass the Mother Test?